When an expectant mother walks into a maternity clinic, every choice she makes is driven by a single instinct: keeping her unborn child safe. So when she is offered a maternal vaccine, like the one for RSV, it is never a simple yes or no. It initiates a complex, continuous calculation of risk for her baby. But all too often, that deep protective instinct slams into the reality of modern healthcare. Instead of a genuine conversation, she is met with a rushed, transactional encounter that feels more like checking a box than providing care. And what she receives is often just this pamphlet. Dense with medical jargon and simplistic phrases like, "it's for your protection," this approach does not create a sense of safety. It actively fractures her foundational trust in the healthcare system. This diagram illustrates a critical failure point in patient care: the information vacuum. This dangerous void opens up when a medical system relies on passive instruction instead of active dialogue. This void is stretched even wider by rigid systemic constraints. When a mother faces massive booking delays just to get an appointment, that friction induces severe anxiety, even for those who arrive already wanting the vaccine. The breaking point comes when these structural issues compound with dismissive care or perceived racial bias. At that moment, institutional authority drops to zero. When a mother feels treated like a checklist item or faces months-long delays for critical care, she stops seeing the clinic as a source of protection. This vacuum leaves her searching for answers elsewhere, highly vulnerable to whatever she finds first. When official guidance is silent or confusing, other, much louder voices instantly rush in to fill the silence. When deciding on maternal vaccines, hesitancy is rarely about personal side effects. Instead, anxieties surrounding childhood immunizations, fear of autism, delays, and vaccine overload spill over. Without clear pharmacological explanations, mothers are left alone to figure out if multiple vaccines might interact and harm their baby. When clinical transparency fails, mothers are forced to anchor their vital risk assessments on alarming community anecdotes rather than medical science. Searching for the truth, they turn to alternative sources: peer networks, online search engines, and the algorithm-driven feeds of TikTok and Instagram. A gripping, lived anecdote from another mother carries immense emotional weight. Contrast that with a sterile, unread NHS pamphlet, and the clinical document simply cannot compete. As this animation shows, the maternal risk calculus completely shifts. The perceived risk of the vaccine starts to feel far heavier than the actual risk of the disease. In the absence of an empathetic clinical dialogue, these negative social narratives become the primary driver of a mother's medical decision, and under these conditions, that choice is entirely rational. Most mothers aren't rejecting medical science. They're pushing back against the oversimplified, one-sided way it's often presented to them. Mothers demand nuance. They desperately want transparent, detailed dialogues that lay out both the concrete advantages and the potential disadvantages of a vaccine. When a provider glosses over potential adverse effects, mothers notice. They recognize the omission as dishonest, and it drives them further away from the clinic's advice. To bridge this gap, the healthcare system must evolve. It must move away from passive instruction and step into an active, balanced partnership. A critical catalyst for repairing this institutional trust is visual storytelling. It has the power to override community misinformation with authentic experience. Imagine a mother watching a video like this. She sees another parent detailing her lived experience of watching her baby fight RSV. It provides relatable, emotional context for a complex clinical decision. This approach changes the standard clinical interaction. Midwives swap the rushed tick-box routine for actual relational continuity, taking the time to listen without coercion or judgment. This kind of transparent, one-to-one interaction honors the mother's protective instinct. It meets her where she is and directly answers her fears about how vaccines interact. Protecting the most vulnerable in society requires a hard truth. Medical trust cannot be handed out in a leaflet. It is only built through empathy, transparent dialogue, and shared human experience.